his research and his career has been committed to really figuring out the mechanisms that of alpha-1 that cause liver damage, and becoming a resource for other researchers, and also continuing to look at ways to prevent and treat liver damage. We're super honored to have him looking into alpha-1. He's done a lot for the community and will continue to, and liver is key, as you'll hear here. He's involved in a variety of national and international clinical studies on liver disease, and he's authored a book to really help all of us, and it's a question and answer book for families that are dealing with liver disease from alpha-1. So he is a huge resource. We're proud to have him here, and without any further ado, Dr. Teckman.
Thank you. Everybody hear me okay? Well, that's a very kind introduction. Thanks for having me. I see a lot of faces that I've seen before, and then a lot of new, so that's great. I'm just kind of going to give sort of some overview about alpha-1 and some about the liver and some just sort of general information. So you know that alpha antitrypsin deficiency can cause liver damage in children and adults and lung disease in adults. What's interesting about alpha antitrypsin is how variable it is. So there are some people that are sick when they're infants. There are some people who get sick as adults. Some people get lung disease. Some people get liver disease. Those things are actually, as far as we know, not really related. So having lung disease doesn't protect you from liver disease and vice versa. And having one doesn't necessarily mean you're going to have the other either. This is just sort of biochemistry talk for what happens, but what's better is to look at this cartoon. So what happens is that the liver makes a huge amount of alpha antitrypsin every day. Alpha antitrypsin is a protein, or a protein chemical, and it's made in the liver and released into the blood. And why does it do that? Well, if you breathe a germ into your lung, your body wants to kill that germ so you don't get pneumonia. And so your body sends white blood cells to your lung. And those white blood cells, what we call phagocytose, or basically eat up, gobble up the bad germs in your lung. And when a white blood cell gobbles up a germ, the white blood cell has some really powerful chemicals that it can actually digest the germ. That's how it kills the germ, okay? The problem is those chemicals are so powerful that it can actually digest your own body as well. And when the white blood cell takes a bite, when I was in medical school, we called this sloppy eater syndrome. Yeah, we really did. That's the truth. So it's like if your mouth is watering and you see that steak and you're going to take a bite, and maybe some of your saliva comes shooting out. It never happened to you, but to my 15-year-old son, that's what happened. Spit shoots out. So that happens when the white blood cell takes a bite of the germ. And some of those dangerous chemicals come out of the white blood cell. If those dangerous chemicals landed on your own cells, it would damage them. Alpha antitrypsin is there to inactivate those dangerous chemicals. So it protects you while your own immune system is killing germs. Okay, that's what alpha antitrypsin is supposed to do. So the problem in alpha antitrypsin deficiency is that your liver still makes lots and lots of alpha antitrypsin, but it makes the wrong kind. So normal alpha antitrypsin is called M as in Mary, which is a long story, which we don't need to go into. But this is sort of the cartoon. So this is a particular room inside your liver cell. We call it ER. It's not emergency room. It stands for something else. But, and inside here, these little light wavy lines are a brand new piece of alpha antitrypsin that gets made. And it has to fold up into a particular shape. And when it's in a particular shape that's going to help your body, then it's released from the liver cell out into your blood. And a few of them don't get made the right way, and they get thrown in the trash. But the problem is, if you have Z, your liver cell is still making all this alpha antitrypsin, but it can't fold up into the right shape very well. Most of it can't fold, and it sticks together in this weird way, and it builds up in the liver. So the blood doesn't have enough, because enough doesn't get released, but the liver has too much. That's why it's called alpha antitrypsin deficiency. It's a blood deficiency that the liver has too much. And the reason is the shape of the alpha antitrypsin. So have you heard this before? But if you take a piece of paper, and it doesn't, you try to throw it, it doesn't really go very far. But if you fold the paper up into an airplane, so it's the same piece of paper, but the shape is critical. Or you can make paper wide. It doesn't even go that far. So the shape is critical. And that's what happens inside the liver. The Z alpha antitrypsin is in the wrong shape, and it builds up in the liver, and that buildup damages the liver. This happens in everybody. And then blood level is low in everybody. But of course, if we were back to that same question, then why doesn't everybody have lung? Why doesn't everybody have liver? Yeah. Well, we're working on that. I'm going to skip some of this just for time. This is sort of biochemistry about how that happens in the liver. So this is your liver microscope. So this is a liver biopsy. So it's a little tiny needle sample of the liver, and put that under the microscope. And the stain with different chemicals and colors. But the red over here, could you turn off the bank of lights? It's kind of bright. But the red blobs. So all these are liver cells. I don't know if you can really see those very well. They're all liver cells. The red blobs are the bad alpha-1 disease that builds up in the liver. In a healthy liver, there are no red blobs. So and these cells. A lot of people sleep. I could do that without being dark. As you'll notice, some of the cells that don't have the red blobs, and some of them do. And the ones that do die. So it's not good. So where's alpha antitrypsin from anyway? Well, this is just sort of a cartoon of what we call the Viking hypothesis. So it turns out that the Z gene is found most commonly in Scandinavia, and it's absolutely most commonly in Denmark, which is here, and this is Norway, Sweden. These are countries that have the highest percentage of people with the Z gene, and then the other parts of the world, as the red line gets thinner, then the frequency goes down. But it's predominantly found in North Europe. Okay. And then the S mutant of alpha antitrypsin is yellow. Okay. There's also a place right here on the Italian Austrian border where there used to be historically a lot of alpha antitrypsin. Why that is, we're not sure. But scientists who study genes do math and try to figure out how long a gene has been in a certain population. When they do that, it looks like the Z gene has been in this area of the world for 1,500 years. Well, that actually is overlapping the time of the Vikings. Remember your history lesson. And the Viking conquest, the Vikings lived in Scandinavia, and then they raped and pillaged and burned all across Northern Europe. And so if you overlay the time and the area of the Viking conquest, you get the frequency of disease. So there's the idea that the Vikings spread the Z gene around. But just so maybe you're part Viking. So because alpha antitrypsin deficiency is so common in Scandinavia, a lot of research done. In fact, the disease was discovered in Sweden, and this just shows a experiment that was done back in 1972, where they screened every baby born for a period of time in Sweden, and identified 127 who were ZZ, and they followed those kids. In some ways, they still follow them, but not very carefully. And that really showed us some important things. What it showed us is that the risk of life-threatening liver disease in children is only about 5%. We think of alpha-1 as a child's liver disease. Not really. It's just that pediatricians like me have been good at recognizing it. Okay. The risk of any liver problem or any health problem in children, depending on how you define it, whether it's a blood test, or kids not losing weight, or kids vomit a lot or something, is between 15 to 50%. Okay. Most ZZ kids who are sick when they're born, most of them get well on their own, which is of course great news. But we still have this 5% group either die or get a liver transplant, and we'd really like to not have that happen. Lung disease really doesn't happen in children. They may have asthma or other breathing problems, but damage to the lung, like adults get, really doesn't seem to happen in children. It looks like that liver disease, damaging liver disease in young adults or even middle-aged adults is fairly uncommon. But the longer you live, the greater your risk of liver disease. And in fact, again, we don't have all the answers to this because we've never really, until now, followed a group of adult patients over time to see what happens to them. But again, the information from Sweden would suggest that if you're ZZ, the risk of serious liver damage over your whole life may be as high as 50%. So that's pretty high. There's also a risk of liver cancer in older adults, which hardly anyone ever talks about. Although it's there. And liver cancer is a very, very dangerous cancer. It tends to be very far advanced before it's diagnosed. It's very hard to treat. What you really like to do is prevent it. Sure. Well, we're just learning that. I would say you're talking people, mid-50s and older. Not that there's anyone in this room that age. I'm going to go talk to the old people later, okay? So there's all this variability. And we don't really understand that very well. Why one person gets liver cancer and the other person gets emphysema, while this child gets a liver transplant and the other child doesn't. We don't understand these things. We know that smoking is bad. We know that there are some other things that are bad we can talk about, but we really need to understand some of these other questions, and me and other people are really working hard to try to do that. So we've got these big questions in mind. How are the lung and the liver damaged? I mean, I told you in broad strokes how that works, but so I started about 20 years ago working on alpha antitrypsin, and 20 years ago we really had just the slightest idea how damage actually happened. And we've done a lot of research over that time, much of it funded by the Alpha One Foundation, and now we have a lot better idea. We still have some questions, but we've learned enough to actually propose how some treatments might work, which is what we need to do. Other big questions: what's the source of the variability? Part of it is environmental, so that is smoking or infections you're exposed to or things like that. But part of it is also genetic, so that means a gene that's not the alpha-1 gene. So you may have a gene that, if you didn't have alpha-antitrypsin deficiency, would make no difference in your life. But if you have alpha-1, maybe that gene predisposes you to liver damage or lung damage, and your brother or sister didn't get that gene from your parents, and so you don't. As I kind of mentioned on the previous slide, if I clicked it too quick, but it's almost like sunburn. So, people who are very, very light-skinned are much more likely to get a sunburn than people that are very dark-skinned with the same amount of sun exposure, right? Very light-skinned people could be out in the sun for 1 hour in Miami and get a sunburn. And, if you're dark-skinned, out in the sun in Miami for an hour, you don't get a sunburn. It's not that the light-skinned person was born with a sunburn, but they're susceptible to it if exposed to the right thing. So we think there may be things like that with regard to lung and liver disease. There's something else that you have which makes you susceptible. And then, of course, how are we going to bring these treatments to people? Treatments are really expensive. How is our society going to figure these things out? And, of course, I have the answer to that at the end of the talk, so stick around. Just kidding. So, how does the liver work, and what does it really do? Well, good question. Your liver, unlike your lungs, everyone's aware of breathing, especially if you're having trouble breathing, you're really aware of it. Or your heart beating, but your liver, you're not really aware of your liver working. So, at least most of the time, unless it's super sick. So your liver lives in the upper right-hand part of your abdomen, and your liver does a lot of different things for you. And that's kind of shown in my kind of weak cartoon here. So this is your esophagus, your throat. This is your stomach. This is your intestines. Food comes down here. Your body takes nutrients out of your food, and all the blood from the intestines with all the nutrients goes to the liver as the next stop in your body. Okay, and your liver processes all the nutrients that you eat. It also, any bad things that you eat, so there are naturally occurring toxins in all kinds of food that you eat. And your liver screens all that out. If you take a medicine, your liver processes it. Your liver also takes waste products from other parts of your body and helps remove that. You have a tube that connects your liver to the intestine. That's your bile duct. This is your gallbladder. And a liquid called bile runs down that tube. That bile helps you digest food. It also removes waste. Your liver makes stuff like alpha antitrypsin. So your liver's doing all these jobs. And sometimes when your liver gets sick, one of these things can go wrong and all the others keep working. So it's not so easy to sort of evaluate the liver. You usually need a pretty wide panel of testing to really understand what the liver is doing, because one thing may be out of whack and everything else is great. Now, what do we do for these things? Well, if your liver's not digesting fat well and you're losing weight, that can happen. If your liver's not making things, your blood can get out of balance. Lots of different bad things can happen. There's also what's called fibrosis or cirrhosis of the liver. This is another one of those things that people say, oh yeah, cirrhosis of the liver, you don't want that. Well, you're right, you don't want that. But what it actually is, people are often a little fuzzy on. So if your liver's damaged repeatedly, scar tissue can build up. So just like if you cut your skin. If you cut your skin a little bit, it heals, there's a tiny white scar there. If you were to cut your skin repeatedly in the same place, it would probably be kind of a bigger white scar, right? The same thing happens in your liver. If your liver's damaged repeatedly, scar tissue builds up in the liver. So here's, again, my little drawing. So here's scar tissue builds up in the liver. And when that happens, the blood coming from the intestine that goes through the liver, that blood doesn't get through very well. So it's like a drain that starts running slow. It's like your kitchen sink, half clogged. And so not much blood can get through to the heart. And the blood can then actually start to go backwards into the rest of your abdomen. So, okay, that's not good. Anytime you're going the wrong way down a one-way street, bad things are going to happen, right? So that's what happens in the abdomen when you have cirrhosis of the liver. The blood starts going the wrong way. Your spleen, which is over on the left side of your body, can swell up and get really big. The blood vessels in the intestine get abnormal, and they can bleed, and you can have life-threatening bleeding in the stomach or the intestines. You can have fluid that builds up in the abdomen because the blood can't get through. So that's what cirrhosis of the liver is. So people can have cirrhosis of the liver, but the liver can still be doing some of those other jobs. Or the liver can be not doing those other jobs, and you can not have cirrhosis. So these are multiple ways the way the liver gets hurt. So what do we do for these things? Well, if your liver's not digesting fat and you have diarrhea, then we can treat that with certain vitamins and different treatments. If your liver's not removing toxins, there's treatments we can give for that. If your liver's not making things like alpha antitrypsin, we can give some of that into your body. But these things are just sort of a Band-Aid. These things are hard to really reverse. We're just sort of helping you cope with it if these things happen to your liver. So what we really want to do is back up and stop the liver from getting damaged or prevent the damage to begin with. That's always the best thing, right? So liver tests. How do we just said all these damaging things, bad stuff can happen. How do we really monitor the liver? Well, there are a whole bunch of different liver tests, so I thought I would touch on those for a minute too. Really, because the risk of liver disease in alpha-1 is, for your lifetime, it's pretty high. Everybody should have some liver evaluation every year. It doesn't mean you need to see a liver specialist if you've never had a problem, but just like people also, I think, need a lung evaluation every year, even if they don't really have symptoms. Most people, if they are doing fine, get some PFTs or lung tests, because you can lose significant amount of lung function with minimal symptom. But you can get a lot of liver damage with a minimal symptom too. So having a thorough evaluation, which is more than just one blood test. It's a physical exam, it's a history, it's feeling the abdomen very carefully, it's looking at a variety of tests. That's really important. And so here are some of the tests that might get done. There's what's called bilirubin. So most people are familiar with this with a newborn. So that's the waste product that can turn you yellow. And if your liver's not working well, it's not removing that waste product from your body, and you can turn yellow. And we measure the bilirubin in your blood, so it can be abnormal even if you're not yellow. So that's something that we commonly look at. There's also these things that are called liver function tests, which actually do not measure any function of the liver. So leave it to doctors to name something that isn't the thing that it is. Some people call these LFTs. They're also called AST and ALT, or OG, SGPT. It's an alphabet soup, but sometimes it's better to call them transaminases. But this is a group of tests which are chemicals that are found inside liver cells. And they leak out into the blood at a very slow rate. So if you're healthy, those blood levels should be low. If liver cells are damaged, those chemicals leak out at a faster rate, blood levels go up. So measuring them is measuring damage to liver cells. And so it's not the function of the liver, it's damage to liver cells. These tests are commonly mildly abnormal in alpha antitrypsin deficiency. That doesn't always mean there's anything bad happening. It just means there's mild irritation in the liver. If these tests are super high, that's bad. But there are even people with cirrhosis where these tests are normal. So unfortunately, a lot of doctors put way more focus on these tests than they deserve. A lot of people think, oh, I've checked your AST this year and it's normal, you're great. Like I say, I have patients myself who have cirrhosis who have a normal ALT. So it's only one of many tests. It's not the only test that should be done. GGT, so that's like these other tests, except it really tells you about that tube, the bile ducts that connect the liver to the intestine. Some people also look at what's called the alkaline phosphatase, or ALK-phos, which kind of tells you the same thing. Blood albumin level, that's a protein like alpha antitrypsin, which is present in the blood. If your liver isn't doing so well and it's not making that very well, blood levels are too low. That's something commonly measured. Your liver is very important in blood clotting, partly because it processes nutrients that are required for your blood to clot, and also because your liver has to make things that help your blood clot. So to test how well your liver's doing, we often measure blood clotting. And there's several different kinds of tests. INR is the most common one, but some people call it PT, PTT. Again, we have to invent crazy names for things that make it very confusing. There's also ammonia. So yes, this is ammonia, just like you clean in the kitchen with. Your body makes ammonia as a waste product. Your liver is responsible for removing ammonia from your blood. So we sometimes, if we're suspecting people their liver might be sick, we sometimes measure their ammonia. Because if it's too high, that's a sign your liver is getting tired. We also like to make a picture of the liver. Doing an ultrasound, like a pregnant woman has when she's pregnant, make a sound picture of the baby. It doesn't hurt, it's not dangerous. Ultrasound of the liver, very, very important test. It, again, doesn't hurt, it's not dangerous, it's not very expensive, but it's really good at helping us understand what's going on in the liver. Some people need CAT scans or CT scans of the liver, or MRIs of the liver, or fibroscans of the liver, all these different ways to scan the liver, but it's kind of the front line is really an ultrasound. And probably everybody, when they're newly diagnosed with alpha antitrypsin deficiency, should get an ultrasound. And how often they should be done after that is controversial, and we don't really know. Certainly if you have liver problems at all, at least a yearly ultrasound. If your liver is like super duper, then maybe once every 5 years or something. But I think these days, ultrasounds are important. And then there's what's called the liver biopsy. So this is the test which still tells us the most about how much damage there is in the liver. The liver biopsy is where your skin over the liver is cleaned off with iodine, so there's no germs there. And a little needle goes into the liver and takes a sample about the size of a toothpick. It's about 1/10,000th of your liver, so it grows back and you don't miss it. But it gives us a tiny little sliver, and we look at it under the microscope and do special tests. And that really tells us, how much fibrosis or cirrhosis is there, what else is going on. So very important. Not everybody needs a liver biopsy, but often it is helpful. It's also especially helpful if more than one thing is going on. So if someone has alpha antitrypsin deficiency and they're on certain medicines and their liver tests are a little off, The liver biopsy might help you decide how much of that is the medicine, how much of that is alpha-1, or if the patient has certain infections, sometimes the liver biopsy is helpful to understand what's going on. And other things can happen in the liver as well. So there are, in our adult liver study, we've had, is what I'm going to talk about in a minute, we've had patients who have had a liver biopsy and something else has been found which we could treat even that wasn't known before. So there's a lot of reasons to have a liver biopsy. You don't need one every year. You don't need one immediately, but it's something that is required sometimes. So how to keep your liver healthy? Well, we already said, monitor it. Don't ignore it. Unfortunately, there's no protein replacement for the liver. There's no prolastin for the liver. And that makes sense, right? Because like we said, the lung disease is because the blood doesn't have enough alpha antitrypsin, but the liver disease is because the liver has too much built up in it. So giving extra alpha antitrypsin doesn't help your liver. There are good treatments for liver disease in general. So like we said, if your liver's not digesting fat and you're low on energy or certain nutrients, we can give you extra nutrients. But that doesn't actually fix the problem. It just sort of helps compensate for it. I think, people often ask about alcohol. So, we don't know what the safe alcohol intake is for alpha antitrypsin. We know that if you drink too much and you have a completely healthy liver, you can hurt your liver. So, low alcohol intake is good. 0 is probably better. Sometimes what we've done is looked at other liver diseases. So, for example, you may have been reading the paper about hepatitis C. So that's a very common liver infection, which can be fatal, but many people have it and don't have any damage. So it's a little like alpha antitrypsin. And some studies have been done that suggested that if you're an adult and you have hepatitis C, but your liver's healthy, that up to 3 drinks per week doesn't change the health of your liver. On the other hand, if people have liver damage from hepatitis C, they're told don't drink at all. So, I think that's, again, we're trying to do the studies now to get that information for alpha-1, but that seems like a rational recommendation. Don't get heavy. I think that's, it's hard in our country because we got a lot of food out there. And everybody knows that, weight is a problem in our country in general. But if you get too heavy, your liver gets fat. And just like that strains your heart, it strains your liver. So that's important. We've done experiments that just in animals, which I can talk about in a little bit, that would suggest that ibuprofen, aspirin type medicines may be especially toxic to the alpha-1 liver, whereas acetaminophen, may not be. Now we know, or that is Tylenol. Now everybody knows that Tylenol in overdose can hurt your liver, but Tylenol in normal doses is probably very, very safe. It's just overdosing which is bad. This is actually an experiment that we did in an animal with alpha antitrypsin. This is where we gave it just some water, and this is where we gave it an indomethacin, which is a medicine like Motrin or ibuprofen. And these black lines are the amount of alpha antitrypsin in the liver in each of these conditions. So these are 3 animals that got the water. These are 3 animals that got the ibuprofen. And you can see that there's a lot more alpha in the liver in the animal that got the ibuprofen. And that alpha in the liver is bad because this is the thing that hurts your liver. So in the animal, when you give ibuprofen, there's more bad stuff in the liver. So if I had alpha antitrypsin and I had a headache, I would take a Tylenol. But is 1 ibuprofen your liver going to explode? No. But I think over long periods of time, take a Tylenol. Some people then ask me, well, my doctor said I should take a baby aspirin every day for my heart. Well, that sounds like a pretty reasonable thing to do. But this just shows that we need a lot more research because we need to understand much better what these things actually mean. Looking for liver cancer. So as we said, there is a risk of liver cancer in alpha-1. We don't know how big the risk is. If you have severe liver damage, then your liver should be monitored with an ultrasound every 6 months. If you don't have severe liver damage, then we don't really know what to recommend at this point. We're trying to learn that. Some of these I can go through. So we're still left with our big questions. So again, this is when I started 20 years ago. This sort of a blank slide was what we knew about what happened in the liver. Maybe that's a bit of an exaggeration, but not too much. So how do we understand about liver or lung disease, and how do we make things better? Well, we have test tubes, we have animals, and we have people to help us make progress. So we have this mouse that has alpha-1 liver disease. And it was, so what they did, and this is, you know, it's amazing. You can take the, you take a mouse and with a little tiny microscope, and when it ovulates, you capture its egg and you put it in a little dish. And we actually have technology where you can take the human Z gene and insert it into the mouse egg. And then you do, it's like in vitro fertilization for human infertility. You take some mouse sperm and you put it in, like, then you imagine how you get that, right? But we won't go into that. You put that in the little dish. There's someone whose job that is, okay? You put it in the dish, and you make a little mousy embryo. And you have another mommy mouse who's been given hormone shots to convince her uterus that she's pregnant even when she isn't. And you have a little tiny little tube, like the size of a hair, and you put it in her uterus and you inject this little egg, which you've inserted the human Z gene into, and that mouse mom gets pregnant. And she gives birth to a mouse, which is a mouse, but it carries the human Z gene. And that mouse gets alpha-1 liver disease. Yeah, it's unbelievable, but true. So this has been, this mouse was developed 25 years ago, but it's been a super duper help to us understanding how the liver gets hurt and a lot of the alpha-1 biology, because there's a lot of things you do to a mouse you can't do to a person, right? So we can not only study how the liver gets hurt, we can test medications. And this is just an example. So this is the human ZZ liver. This is the alpha-1 mouse liver. This is stained with the chemicals to make the bad Z building up the liver turn red. So you can see that they look very similar. So the alpha-1 liver in the mouse is very similar to the human. So it's allowed us to sort of make a map of how the liver gets hurt. And let me see here. It turns out that over the last few years, we can cure the liver in the alpha-1 mouse in about 10 different ways. So we've got about 10 different medicines or chemicals that can cure the liver in the alpha-1 mouse. So you're saying, well, where is that? How do I get that? Can you write a prescription for that? Well, there's a big leap between treating a mouse and treating a person, obviously. And that takes a lot of money, and it takes time, because nobody wants to make a person sick. I mean, it's hard to see if a mouse is having a side effect. I mean, if it dies, you know it had a side effect. But, you can't say to a mouse, do you have a headache? Are you nauseated? Do you have abdominal pain? Are you short of breath? All these things that a medicine might do to a person, it's hard to figure that out with a mouse, right? But we have done some things. So this is what happens in the liver cell. You have the alpha-1 builds up in the liver cell, and bad things happen to the liver cell, and they die, and the liver gets hurt. What if you could sort of sidetrack it? Instead of letting the bad alpha-1 protein cause all this, what if you could sidetrack it over here? So we have several medicines, in fact, that can do that in the mouse. And this is an example. So here's all the red bad stuff in the regular alpha-1 mouse. And this is a mouse that got a medication that did that sidetracking, and all the red goes away. We can wash it out of the liver. So that's pretty cool. So it turns out, as I said, there are several medicines that can do that to the mouse. Now, there is a human trial going on in Pittsburgh for people who are very, very sick, so people who, based around a liver transplant list for alpha-1, who get some doses of a medicine like this over a couple of years to see if it helps. So that's exciting. We don't have any results yet. But what if we could do this? So what if we could just tell the liver to stop making the bad thing? If you just tell the liver to stop making the bad Z, would it stop building up in the liver? Would it stop causing damage? And we actually can do that. So we've done that with several drugs in the mouse. And so the top row here is 4 individual mice, just the regular alpha-1 mice. Here's the red bad stuff in the liver. And here are 4 individual mice that got the drug to tell the liver to stop making the bad Z thing. And you can see that there's hardly any red left on the bottom row. So, these things, they cure the mouse, man. It's really, really great. Some of this is just other stuff, so I'll skip that. But we still are left with how are we going to translate curing a mouse to curing a person. In our system in the United States, we really depend on drug companies and private industry to put a lot of money into developing a drug from the point of a lab cure to a person cure. And the drug companies, they want to know things like, how many people with alpha-1 are we going to sell our medicine to? And how long are they going to have to take it? And, when should we give it to them? Is this something drug we're going to give to every alpha? Or are we going to give it to some people? Just like protein replacement. Not every alpha has lung disease. Not every alpha is on protein replacement. So if we had a liver cure, it would probably be the same thing. Some people would get it, some people wouldn't. How do we decide that? These are all questions we don't have the answer to. And many of the drug companies are waiting to bring forward liver treatments to get these answers. So we're trying to get the answers. How are we doing that? Well, the Alpha-1 Foundation has the registry. That's super important to be in the registry. Some of this is a little short on time, so I'll keep flipping here. The Alpha-1 Foundation is spending a lot of money to fund an adult liver study, the first of its kind that's ever been done, where we're going to follow groups of adults with alpha antitrypsin deficiency every year for a number of years going forward. And those people are getting a wide panel of liver tests, which they get the results of. So it's really a liver checkup. And then we follow to see what happens with their liver. We see, if you have this much liver damage, several years from now, is that the same? Did it get better? Did it get worse? How many people have liver damage? What kind of blood tests of all those tests I showed you? We need to know which ones are the most predictive of your liver getting worse. And then this is going to give information to the companies to help us get liver cures out. We have a table outside for the liver study. This is super, super important. We're just not going to make progress without getting some of these answers. There's also, for children, there's what's called the Children Network, which stands for Childhood Liver Disease Research and Education Network. So this is a study funded by the NIH, so that's the government, that's your tax money. So the one study is funded by the Alpha-1 Foundation, which is your donation money. This is a study funded by your tax money. So, you're paying for this stuff. So we want to make it the best we can. The children's study follows 400 ZZ and SZ children from 15 children's hospitals all over the country, including here in St. Louis. And we enrolled the first patient in 2007. So we've been following kids since 2007. Every year, looking at their blood tests, looking at their DNA, keeping track of the medicines they take, and if they have asthma attacks, and trying to understand who gets sick and who doesn't, so that when we can convince these drug companies to come and bring some treatments to the kids that need transplants, so they don't need a transplant. So we can avert that and block the liver damage. We can block it in the mouse. If we can do that in a person, liver transplants or alpha-1 or liver cancer in alpha-1 will be a thing of the past. This is our map of the Children's Center sites. I think my time is up because I have a couple of minutes for questions. I'll stop there, but I think our message is we've learned a lot compared to when I started out. We still have a lot to learn. It's really critical. The risk of liver disease for your life is high. Many people liver disease can occur quickly. I've seen many patients in this community who have had checkups and really don't have liver damage, and they stop thinking about it because they think, well, I'm not liver affected, and then 10 years go by, and then all of a sudden they're really sick. So we need a way to understand that. We need a way to stop that. And that's what we're trying to do with these liver studies. So involvement in these liver studies for both adults and children are really, really important. And we really encourage you to participate because, we're all paying for it, and hopefully we can all benefit. So I'll stop. And you stopped asking questions, so I don't know if that meant. But, well, it said this is only based on animal studies. We've never tested it in people, which, of course, would not be ethical. We can't just round up some alphas and say, here, take ibuprofen, let's see if you get sick. So we wouldn't do that, of course. But right, I mean, I think the animal data is pretty clear that high doses of ibuprofen can be bad for the alpha-1 liver. So, like I said, if it was, what I recommend my patients is if you have a headache, I would take a Tylenol. Well, again, this is a common misconception because the, overdose of Tylenol can hurt your liver. And that's, commonly in the press, and doctors know about that. But that's overdose. So in normal dose, Tylenol is incredibly safe. And in normal dose, ibuprofen is actually toxic.
I'm confused about, okay, I get it that if you're a ZZ, it's building up in your liver. How come there are some people who are ZZs that are lung affected and they get augmentation therapy? It's like counterintuitive. Is it going to just different places?
Right. It doesn't go back into the liver. The liver produces alpha-1 and releases it. So if you're ZZ, the liver produces alpha-1, but 85% gets held in the liver, only 15% gets released, okay? So augmentation therapy just puts alpha-1 into your blood, but it doesn't go to your liver. It just circulates around. It does go through the liver, but it doesn't get taken up into the liver cells. You're not crazy. It is. These are hard concepts, and I think this is why it's taken us so long to really understand this disease and to bring treatments forward. Because, and I think it's still somewhat oversimplified because, as many of you know, replacement therapy is good, but it's not like not having alpha antitrypsin deficiency, right? And so there's more to the story, even for the lung disease, than just giving it back. And there's stuff I didn't have time to talk about that might explain some of that. But and the liver and the lung are really, really related. I think in this community sometimes we've done ourselves a disservice by talking about lung affected and liver affected like they're separate things. They are not separate things. Everybody with alpha antitrypsin deficiency has buildup in their liver. Okay, whether there's been damage or not, that's a different thing. But everyone has the potential to get damage. Same with lung disease. Everybody with alpha antitrypsin deficiency, their lungs are very susceptible to damage. Now, maybe they don't have it right now, but they're still very susceptible. And these things are very closely related. In fact, we have some information, which I really can't share with you at this point, but that there's even more connection between lung and liver damage than we thought. So I think we should change our thinking from lung affected, liver affected to alpha antitrypsin deficiency, lung and liver disease.
Perfect. Thank you so much, Dr. Teckman.